Okay, external anatomy of the heart. You have the right auricle, which is a flap-like structure. The chamber is the right atrium. This would be your right ventricle. This is your left ventricle, left atrium, and the chamber, or excuse me, left auricle. The chamber is the left atrium. Okay, separating the right and the left ventricles where the artery and vein are, that is your interventricular sulcus or septum, and that superficially marks where the interventricular septum is inside, which separates the right and left ventricles of the heart. You can see the great vessels of the heart, okay, which is where the base is. Okay, you have the pulmonary trunk, you have the aorta, the aortic arch, you have the superior vena cava, and you can only see a very small of the inferior vena cava. You can see the ligamentum arteriosum, which is the remnant of the ductus arteriosus in the fetus. If I wanted to, I could actually ask the branches of the aorta here. This is your right brachiocephalic trunk. This is your right common carotid artery. No, excuse me. Brachiocephalic trunk. Branching from that, you have the right subclavian artery and the right common carotid artery. 14 is your left common carotid artery. 15 is the left subclavian artery. Okay, blood leaving the aorta will enter the systemic circuit. Blood leaving the pulmonary trunk will enter the pulmonary circuit where gas exchange occurs. So now you have oxygenated blood that returns to the heart through the pulmonary veins. This would be the left pulmonary veins coming from the left lung. And then if I look at the back side of the heart, I have the right pulmonary veins that are bringing the freshly oxygenated blood from the right lung. Apex of the heart is this pointed region here. Coronary vessels, starting with arteries. This is your right coronary artery. This is the left coronary artery, just the small part here. It immediately branches into the anterior interventricular artery and the circumflex artery. Then we have the posterior interventricular artery. And this from over here, again, this is still the right coronary artery, circling from the right side. Veins. This is your great cardiac vein. You have anterior cardiac veins, the marginal vein, the middle vein. All of that gets dumped into the coronary sinus. Actually, sorry, that's right here. Coronary sinus, which will dump into the right atrium. I can see the opening of the coronary sinus, that's 58. Okay, 55 represents the fossa ovalis, which is the remnant of the foramen ovale in the fetus. I can see the textured muscle in the atria, which is called pectinate. This would be your right atrioventricular valve or tricuspid valve with the heartstrings, chordae tendineae attached, and 40 and 42, which are showing as papillary muscles. You have textured muscle in the ventricle, which would be your trabeculae carneae. This actual wall, this represents the interventricular septum. This is your pulmonary semilunar valve. Left side of the heart, you also have that textured pectinate muscle. This would be your left atrioventricular valve, bicuspid or mitral valve, again with the chordae tendineae and papillary muscle. You still have the trabeculae carneae, textured muscle there. Notice a little bit, the model doesn't show it quite as well, but this is thinner layer on the right ventricle versus a little bit thicker on the left. And if you kind of look up and into here, if I move over the left AV valve, that white right there is your aortic semilunar valve. Also from the inside here, you can see the conduction system. 32 represents the sinoatrial node, which sets the rhythm of the heart. 36 represents the AV node, where you have a slight delay before the impulse is sent down the ventricle. Here they're not showing it, but you would have a bundle of His. They're just showing the AV bundles down the right and left sides in white, and then going up the sides on each of the ventricles. Here and here would be your Purkinje fibers. Layers of the heart: from the inside, it's endocardium. The actual wall is the myocardium. From the outside, you have the visceral pericardium or the epicardium. And then if the heart is completely covered by a sac, that would represent your parietal pericardium.